When we talk about exercise, its benefits come to our minds. Although the beneficial effects of exercise are not hidden from anyone. Still, not all workouts are healthy, and the harms of doing some exercises outweigh the benefits. Stay tuned with us if you want to know what exercises are avoided because they are more likely to cause injury. Injury from a particular exercise movement depends on the person doing the exercise. Some exercises can benefit the individual, but the harms outweigh the benefits. Others are useful for professional athletes, but doing them can hurt people who are just starting out. On the other hand, those who suffer from muscle and joint problems should be more careful in choosing training movements. Fortunately, for almost all harmful movements, there is an alternative exercise. And for everyone, even in the most severe cases of the disease, some exercises help maintain health. Let's begin with our number 7. Leg raise. This exercise is recommended to strengthen the leg and grow abdominal muscles. If the abdominal muscles become tired or weak during exercise, this movement increases the lumbar arch and the pressure on the intervertebral disc in the lumbar region increases. On the other hand, strong contraction of the muscles in the front and back of the spine increases the internal pressure. The disc becomes lumbar, and the patient's pain worsens or even causes the disc to recur. Therefore, this movement is avoided in people with a protruding disc until the abdominal muscles are not well strengthened. Number 6. Crunch. Crunch has been considered a way to strengthen the abdominal muscles. But if the sit-up muscles are weak, instead of activating and strengthening the abdominal muscles, the spine muscles are activated, and if this exercise is not done properly, it can damage the lumbar spine by increasing the lumbar arch and pressure on the disc. This should be considered in people whose joints are too loose, especially in children. To do a crunch, the knees should be bent, and the sitting pose should be done slowly. The legs should not get stuck. Bending the legs causes the back muscles to become active instead of the abdominal muscles. In case of the relative weakness of the abdominal muscles, a small pillow can be placed behind the shoulder, and the hand should be on the chest instead of behind the head. Number 5. Neck stretches. In general, sudden movements of the spine should be avoided. Neck rotation movements are okay if done gently, and the neck is not bent backward. But bending the neck backward, especially in the elderly or people with rheumatoid arthritis, can have serious risks. If it is sudden, doing this movement can damage the arteries and nerves at the base of the skull. People with cervical spondylosis, osteoporosis, or a history of neck trauma and pain are also more likely to be injured. Placing the back cushion on the car seat is also precisely to prevent the neck from moving suddenly backward during an accident. Number 4. Hamstring stretch. One of the most essential stretches for maintaining a healthy spine is stretching the muscles behind the thighs. But doing it can cause joint damage. For example, some people do this stretch by placing one foot in a high place. If the angle of the leg above the vertical line is more than 90 degrees and the chest is bent forward, research has shown that this may put pressure on the sciatic nerve. If you haven't subscribed yet, please subscribe to our channel and press the notification bell. Now, let's dive right into the number 3 of our list. Upright barbell row. Upright barbell row is done to grow the shoulders and trapezius muscles. It is one of the most harmful exercises you can use to strengthen your shoulder muscles. The problem with this exercise is that your arms have to be in a position to move. This position is called internal rotation. To show internal rotation, keep the arms straight to the sides and the palms facing down. Now rotate your hands forward so that the palms of your hands are facing the ground. To make this motion, the arms are bent at the elbows and then rotated inward. Internal rotation is not necessarily bad for your shoulders. This problem occurs when you raise your arms and create resistance in that position. Each time you lift weights, a small tendon in your shoulder contracts by the shoulder bones. This condition may not hurt immediately. It may not even be damaged for a long time. The problem is that the tendon gradually wears out and is injured. You may not even know you have a problem until one day you have a tendon rupture. Number 2. Behind the neck lot pull down. This exercise is done to strengthen the back muscles. While the main goal is to train your back muscles, the problem with this exercise is its effect on your shoulders. In the previous movement, we talked about the internal rotation of the shoulders. The problem is the rotation of the back of the neck in the external rotation. Position the arms as in the previous example, except that this time, rotate your arms back so that the palms are facing up. This motion is the opposite of internal rotation. To open the armpit wristband according to the usual instructions, you should rotate your shoulders as much as possible. This is a very delicate position for your shoulders. In this case, the supporting muscles of the shoulders, known as the rotator cuff, are not in a good position to stabilize the joint and may lead to damage to the supporting muscles, which can lead to further damage to the joint connective tissue. In addition, since most people do not have enough shoulder flexibility to do this, they must bend their necks forward to move. This can also lead to a neck injury. Number 1. Deadlifts with barbells. The hamstring deadlift is a great move to strengthen the hamstrings, hips, and waist. But the problem is where you are trying to increase the traction in the hamstring. The exercise is done standing on a block or bench. To create maximum traction in the hamstring area and protect the back from injury, a proper arch should be maintained in the lower back while moving. It is challenging to hold the arch at the waist when you can drop it to the ground without the arch. In fact, the barbell pulls you down. Without the arch, as a natural result, the spine bends, and the muscles supporting the spine relax. This puts most of the tension directly on the connective tissue and bones of the spine instead of the muscles that support the spine. In this case, while trying to create more traction on the hamstring, you are actually endangering the supporting structures of your lower back. Which one of these exercises have you done before? Did they cause any injury for you? Feel free to share your ideas and experiences with us in the comments section below. Please share this video with your friends and family. And subscribe to our channel. Don't forget to watch more of our amazing videos on the left and right of your screen.